So we're here in the sports therapy room. Rob, if I was to come to you for an initial sports therapy session, what would that entail and why would I benefit?
Okay, so most people that come for a sports therapy session normally have some kind of injury. Okay, so what we'd be looking to do within the initial sports therapy assessment is to find out what is actually going on with a patient, what the actual injury is, because they could have been misdiagnosed many times before and been told it's a certain pathology or injury when it actually might not be. So what to expect when you come in for the first assessment is what we'll do is we'll initially do a subjective assessment, which is basically questioning through personal details, obviously all consented, so everything that is discussed within the room as well will stay within the room and the clinic and myself. From that subjective assessment, it will give me an indication of what potentially could already be going on or what previous injuries may have resulted in this certain injury that you've come in for me to have a look at, okay? So after that, what we'll do is a passive assessment. So within the passive assessment, we'll be looking at, for instance, your range of movement within the joints. Does every joint have its capable range of movement? Does it have all its capabilities? Then we're looking actually at your passive movements itself, so me helping that joint move to look at ligamentous structures, tendons, capsules, any meniscus problems for instance, and then we'll be looking at the resisted movements as well. So resisted movements is me putting pressure on the joint or on the tissues to see actually how much strength the tissues actually have in them, and that gives me a very good indication if you've got a muscular strain or if it is something more joint related as well, okay? So from all of that then, I can diagnose you, I can give you a diagnosis of what I think is the injury and how we will move forward with that injury.